Hello, students. This is Professor Marvel with the course content week 3 recording. So hope everybody's doing well. I'm going to share my screen here. All of the readings from this week are in your module. There are no readings assigned to the book. Let's see. We are going to be discussing migrant farm worker this week, migrant farm workers, rural populations, homelessness, and poverty. So I'd like to start by reviewing. I know you have your notes and we'll review those in a minute, but I'd like to start by reviewing your module readings in there, right in your week 3 module. So let's talk about migrant farm workers. Okay. The first, and you need to read all these four of these education pages in the module. I'm not going to go through each line by line, but migrant farm workers is a big part of community nursing, especially in the rural community. Okay. According to the National Center of Farm Workers Health, approximately 16% are migrant workers, right? And 84% are the seasonal migrant workers. These populations are predominantly Hispanic and Latino, and a significant portion of this population was born in Mexico. Okay. This is a good video for you to watch with regards to the demographics of the migrant workers. Okay, so what are some of the common health concerns specific to migrant workers and their families? Well, they're listed here. Heat-related illnesses, exposure to a variety of pesticides and toxic chemicals, urinary tract infections, due to unsafe or unhealthy work environment, bites from animals, whether it be insects, rodents, snakes. This population is at higher susceptibility for infectious diseases, and mental health issues are another health concern for the migrant worker, especially depression. So have a look at those common health concerns. Okay, so the other big topic with migrant health workers is barriers. All right, so what are some of the barriers that prevent these rural migrant farm workers from receiving health care or healthcare coverage? All right, so we know that farm workers face numerous challenges when seeking out healthcare, seeking out affordable healthcare coverage. And what are some of those? The cost of healthcare, the shortages of healthcare services in the rural area. Think about it. The community will have access to usually family practice, primary care, but as far as specialty services, with regards to, let's say, oncology or high-risk OB, cardiac doctors, those specifically aren't in the rural areas. You have to travel for those services to the nearest largest community. Cultural differences, cultural beliefs, maybe language barriers, and the access to, say, interpreters. Definitely a lack of coverage, a lack of information about coverage options. And then there's all these eligibility requirements of who can qualify and who can't. So that can be a barrier for them. And a lot of these seasonal migrant farm worker jobs are hourly or daily rates. So they don't have a healthcare plan that gives them sick leave or vacation days or personal leave. So they're less likely to seek out healthcare if they have to take a day off and miss their paycheck for that day. Social isolation and exclusion is a big concern. And then lastly, for the undocumented workers, fear of how their immigration status will affect eligibility. Okay, so we know that the frequent relocation involved with migrant working and farm workers creates a huge challenge for the continuity of care. All right. And that's why when we finally do see this population in the urgent cares of the ER, they're whatever's going on with them is usually pretty advanced because they don't seek out primary care. Okay. Common for these workers are diabetes, cancer, and HIV. Okay. And then their constant relocation is coupled with the general inaccessibility of healthcare. All right. And so they just don't seek out basic preventative care for themselves and for their children. A lot of this population brings their family along. Okay. So take a look at the videos on this page. Okay. And this is an excellent link to rural health information. So have a look at that and look at the statistics. They're pretty amazing. The next topic is rural populations, healthcare access in rural communities. Okay. Again, like the migrant population, rural residents face a variety of barriers as well. Okay. I mean, we hope that all residents should be able to conveniently and confidently be able to access services such as primary care, dental care, behavioral health, emergency care, public health services. And why, I mean, everybody should be able to have access to that. Okay, but in these communities, they don't. All right, so the rural communities, again, often encounter barriers to healthcare that limit their ability to obtain the care they need. In order for rural residents to have sufficient access, necessary and appropriate healthcare services need to be available in a timely manner. Okay. So not only having good access to healthcare for the rural population is a must, but they also must have the financial means. And a lot of this sounds similar to the migrant population, and it is. They must have the financial means to purchase insurance if they can qualify for it. They also must have the means for transportation to services, and that is a big issue in migrant and rural populations is the lack of transportation, the ability to get paid time off. We talked about that. And then potential language and cultural barriers may be a inhibitor or barrier for this population to communicate with healthcare providers. Okay. And then there's certainly a trust issue of being able to keep their private information private. Okay, they worry about that. And then there's also a belief that they may not receive the quality of care that others receive. Okay, so the most important barriers that we've talked about for this group are workforce shortages and health insurance status, transportation, health literacy, right? And then there's also a stigma that goes along with conditions in rural communities, such as mental health and substance abuse. Okay, so I'd like for you to have a look at this link and this link to learn more about the rural populations. Again, I'm just doing a summary for you. And then here's some of the barriers to healthcare access in the rural areas spelled out a little in more detail with regards to transportation, workforce shortages, health insurance coverage, broadband, so internet access, literacy, social stigmas and privacy issues. Okay, so I want you to be aware of what the primary barriers are, and they're listed right here, and read through each of these. Okay, because these are addressed on the exam. Okay, community nursing focuses on rural health and migrant workers and agricultural workers. So we need to have an understanding of what barriers they may face. Okay, so have a look at these sections. And then this is quite a visual with regards to health professional shortages. A lot of rural, look at all that in purple, these are the rural areas. Okay. So please be familiar with this population and the barriers that they may face. Okay. So what types of healthcare services are frequently difficult to access in the rural areas? Okay, one is home health. Okay, the traveling, the distance, reimbursement for coverages, homebound status requirement with Medicare, and then the ongoing changes in rules and regulations for home care in the rural settings. Then the workforce changes. It's really hard to recruit in the rural areas for healthcare professionals, whether it be doctors or nurses or therapists or techs, whatever. It's just very hard to recruit to work in the rural area. And then we talked about transportation, the time and resources required to go to those patients that live a long distance away from the nearest city. Okay. Referrals are difficult from the rural population. Referrals are difficult for the rural population because you're calling down or trying to coordinate with the nearest hospital that may be 500 miles away. Okay. Hospice and palliative care are also face barriers and challenges in the rural areas. Again, workforce shortages, recruitment, retention, reimbursement, limited ability to the internet, mental health services. The access to mental health services in the rural areas is also a barrier. Okay, primary care physicians often fill the gap and try and provide a wide variety of resources, but they may not specialize in mental health. Okay, another pretty big visual of mental health shortages in rural areas. All the purple are the rural areas. Okay, so substance abuse disorder services. We know that substance abuse is a big problem in rural areas, but despite the growing need for services, the access to services is very limited. Pardon me. And then OB and maternal health services. You know, if you have a high-risk pregnancy, there's typically not high-risk OB services in the rural community. Okay, so I want you to have a look at that as well. Oral health services. We know that dental oral health services can affect your overall physical and emotional health. Okay. Traditionally, health insurance plans have not covered oral health services. It's separate. You have your medical, your dental, your vision. Okay, so here's some information about that. How do rural healthcare facilities and services closures impact the access to care? Right. Well, we know that whenever we have closures of rural health services or facilities, or the discontinuation of services, this obviously will have a negative impact to the healthcare of the rural communities. I mean, local rural healthcare systems are fragile anyway, with limited services. So if providers leave or clinics close or hospitals close, it impacts care for everybody. Okay. And then we talked about travel, transportation if you have to go to a hospital in the cities. Very, very challenging if you don't have the resources. And then I'd like for you to have a look at what are the strategies that are already in place or being worked on to improve access to care in rural communities. There's a couple of delivery models, fascinating information on how many agencies are working specifically with improving access for rural communities, with regards to delivery models, healthcare delivery models, maybe affiliating with a larger system or network in the nearest large city. Okay, and then certainly efforts to improve the recruitment retention of hiring of the workforce. Okay, big problem. Telehealth is also being used as a method to improve access to rural health care. Okay, and then veterans, a lot of veterans in the rural communities, what's being done to help them get better access to health care? And then same with American Indians, Alaska Natives, and Native Hawaiians. Again, a lot of this population lives in the rural communities. So what's being done to help them? Lots of good information on that. And then here's a list of what organizations are working to improve rural healthcare access. There's lots of them. It's really very impressive, all the work that's being done for access for rural communities. So have a look at that. Okay. Rural communities, migrant communities face a big challenge with healthcare. Okay, and then homelessness. We talk about homelessness a lot in this class. We know that homelessness affects men, women, children of all races and ethnicities, right? It's reported that on any one given night, over 600,000 people in the United States may be homeless. Okay, and even sadder, a little more than 1/3 of those 600,000 are families. And I know in my experience with school nursing during my last 2 years during the pandemic, the number of homeless families increased dramatically. Okay. We know that homeless people are more likely to become ill, have greater hospitalizations, and they're more likely to die at a younger age than the general population. Okay, the average lifespan for a homeless person is between 42 and 52 years old. We know that with homeless kids, the children are much sicker. They have academic issues, they have behavioral problems. Okay. We know that with the homeless, they may have complex advanced medical problems and psychiatric illnesses that could be exacerbated by drug and alcohol abuse. And then if you combine those with economic issues and social issues, this makes this a very unique population that is in need of resources and services. It's a big challenge for our local homelessness population is a huge challenge for our local communities and states and government. Okay. What does it take to help the homeless? It takes a multidisciplinary healthcare team, okay, with an outreach focus, okay, that needs to be aware of local and state agencies and resources to help. Okay, they need to make sure this population has access to quality care, to medical appointments. Okay. What is the definition of a homeless person? Homeless people are individuals without a permanent housing who may live on the streets. They may live in a shelter, maybe a mission, single room occupancy facility, maybe even an abandoned building. And a lot of homeless people and families are living in their vehicles. Okay. People are also considered homeless if they have a circumstance, let's say they are living with friends or family, but they don't have a permanent place of residence. Okay, they are still considered homeless. Okay, as we said, homeless affects everybody. Men, women, children, all races, ethnicities. Okay. We know that over the past 30 years, pardon me, the increase in poverty and the growing shortage of affordable housing has Has the homeless population trending up? Okay. Some risk factors with the homeless population: more chronic illnesses, more substance abuse, more mental illness. Okay. Here's some pretty sobering thoughts about the homeless population. They are 3 to 6 times more likely to become ill. Their hospitalization rates are 4 times higher. And they are 3 to 4 times more likely to die at a younger age. Disability is often the result of medical and psychiatric conditions, and that becomes a barrier to employment and kind of perpetuates the cycle of homelessness. And then we know that homelessness has significant negative impacts on kids. Okay, infants born into homelessness have low birth weights. They're 9 times more likely to die within the first 12 months. Homeless kids are much more sick than kids who are not homeless, 4 times more sick, right? They have an increased incidence of asthma, iron deficiency, lead poisoning, respiratory infections, ear infections, emotional behavioral problems, maybe anxiety, depression, aggression, hostility. And then these kids are 4 times more likely to demonstrate delayed development, even more likely to have stunted growth, and have twice the expected rate of learning disabilities. These kids that are homeless often experience hunger, abuse, neglect, separation from family, poor nutrition. And then the next part of this talks about approach. What is the initial approach? How do we identify a homeless patient, homeless client? How do we communicate with them? How do we develop trust? Really, really important, right? So read through this. It talks about outreach will probably be the first contact with a homeless client, right? Demonstrating genuine interest, empathy, respect, non-threatening, non-judgmental, right? So the initial goal is to address the symptomatic problems first. Okay. Once trust and rapport are established, maybe visits can be scheduled for the adults or the kids. Okay, but first trust has to be established. But the outreach efforts will then focus on social, medical, mental health problems, and maybe end of life issues. And then here's some of the clinical and medical conditions that are common to the homeless population. Okay. It's interesting, homeless people tend to have the same medical conditions as the general population. They differ from the general population in the fact that they experience long-term exposure to diseases, overcrowding, unsanitary conditions, poor nutrition, sleep deprivation, and others. So as I said earlier, homeless people tend to be present with advanced disease than the general population, as they're not seeking out the primary care. Some common medical conditions with homeless: cardiovascular disease, maybe dual diagnosis, mental illness and substance abuse, cognitive disorders, maybe a TBI, past TBI, injuries and violence, domestic violence, rape, physical assaults occur regularly in the homeless population, maybe as a result of anxiety, PTSD, depression. This is a good table, table 1 here, special considerations in healthcare for the homeless people. Okay, have a look at that, please. Some other issues, skin and foot problems, exposure related conditions, heat, cold. What does that look like? So have a look at this page. It has a lot of good references, a lot of good suggestions for resources for the homeless, how to care for them, or special considerations for medications, special considerations for healthcare. Really good section. Lots of good resources and links. Then the last group is poverty. Okay, what do we know about poverty? What do we know about poverty as it affects the health of the individual, the health of the family, the health of the community? Okay, we know that living in poverty affects all facets of life. The beginning of this is kind of the history, which I want to skip through, but the geographics. Okay, geographics of poverty. Poverty tends to be clustered in certain regions of the country. Okay, counties, neighborhoods, rather than being spread evenly across the nation. Right, research has shown that the poor living areas where poverty is prevalent face impediments beyond those of their individual circumstances. Maybe poor housing, poor health conditions, high crime, increased school dropout rates, employment issues, right? So as a result, economic conditions in very poor areas create very limited opportunities for poor residents to become self-perpetuating or self-sufficient. And here's a graphic by geographic location in the nation. Right, we know that non-metro counties with a high incidence of poverty are mainly located in the South. A lot of this page is statistics with regards to race and ethnicity, geographic location, by family type, by age group. And then it goes through how is poverty defined. Okay, well, the federal government determines what the poverty threshold is. Okay, it's continuously adjusted for inflation, but it is that is the poverty threshold is what the government uses to determine if individuals, families are living in poverty. Okay. So any family, individual with a total income less than the amount deemed to be sufficient to cover essentials, food, shelter, clothing. If they can't meet that, they're classified as poor. Okay, and then there's a link here to how the Census Bureau measures poverty. The amount of income necessary to purchase their basic needs is set by the OMB, Office of Management and Budget. So for example, in 2019, the poverty line was 13,300 for an individual under 65 and different for those over 65. And then it goes through some other statistics of family of 3. Okay. So poverty creates great big challenges for families by region, by age, by ethnicity. I want to pull up our notes. Our notes are a summary of what we've just been talking about. So please refer to your notes along with this recording. It's more detailed with regards to the rural and migrant health. Okay. And we talked about migrant farm workers, but please have a look at this. We talked about poverty and homelessness. Okay, so this is just a summary. This, under the homelessness section, it gives you some examples of what would be some primary, secondary, and tertiary interventions for healthcare professionals and working with this population. Okay, so have a look at your notes. They supplement the readings for this week, and then we'll go through any questions you might have go through any questions you might have in class this week. Okay. All right, thank you.